Hello, today is May 31st. It's day -8 for my bone marrow transplant. I'm just now checking into OHSU. I've been here for about an hour or two and they've already poked and prodded me and they've taken some blood. This is my room. It's the presidential suite. It's a very, very big room. As a matter of fact, the nurses don't like it. As you can see, I got these three big picture windows too, and I'll show you the view later. But the nurses don't like it because it's such a far walk to the bathroom back here, if you can see. And actually, to tell you the truth, I'm not going to like it this time either because just for that very reason, it's a long walk to the bathroom. I'd rather be real close because I'm going to be hooked up to IVs. I'm going to have to drag it all the way across the room. I'm probably a good 18 feet from the entrance to the door. This is my view. It's absolutely gorgeous. It's the, I guess the south portion of the Willamette River. You can look down there. You can see the Ross Island Bridge. You can see the rest of OHSU down there. There's a tram that goes down there. Over here is the Tillicum Crossing. Anyway, it is a really nice room to sit in while they're while they're taking care of you here. It helps keep your spirits up. Anyway, what I want to talk to you, and hopefully it's a good omen for what's going to happen to me. But I was in this room back in March, and everyone kept telling me, "You're lucky. You're in the presidential suite." So, according to OHSU, there are 9 different plans that they use when it comes to time to do bone marrow transplant, and this is their plans. Your plan at a different clinic might be something else. Based on my age and all these other factors, the type of CML I have. Remember, I presented another blast phase based on my age and my physical thing, and the test they gave me, and I came with a -3 on the tests. -1 point went to my heart because it's kind of shaped weird. 2 negative points went to my lungs because I had smoked for 37 years, and right now I have moderate lung capability compared to mild or better or whatever, I don't know. But anyway, my plan for my chemotherapy is I will started with drugs called Clinopin and Keppra, and those are to help prevent me having seizures while I'm having the chemotherapy drugs. They're also going to start me on a drug called allopurinol, and this will protect my kidneys as my body works to discharge cells that are going to be killed off by the chemotherapy. The allopurinol tablets will be given to me by mouth 3 times a day for 7 days. I will then begin a therapy called busulfan, and this is one of the chemo drugs. This medicine is given by IV once daily for 3 hours over 4 days. So at midnight tonight, in about 3.5 hours, they're going to come in here and they're going to hook me up to this thing, and it's going to run through my body for 3 hours. After I do the 4 days of the busulfan treatment, I'm going to receive 2 doses of cyclophosphamide, and that's a 2-hour transfusion by IV, and it says in parentheses, through a small tube leading to the bloodstream. Well, I have a small tube leading to the bloodstream. It's called my PICC line. So I'm hoping they're meaning that, and they're not going to jam something else into me, but we'll see, and we'll talk about it when we get there. This dose of therapy is high enough to kill cancer cells, but will also kill my normal blood-forming cells. So that means that for sure I'm going to need platelet transfusions, and I'm going to need red blood cell transfusions because basically the blood in me is going to wipe out my counts, and they'll have to be replenished with the platelets and the red blood cells. So we'll do that all over again. When I'm giving the cyclophosphamide, I'll also be given a medication called Mesna, and that will protect my bladder from damage. And I've heard about this already when I was talking to Dr. Gandhi last Friday. Mesna will basically kind of coat the inside of my bladder so that the chemo drugs won't damage it. Apparently that's a side effect that the chemo drugs have. Seeing that I'm undergoing this regimen of the busulfan and cyclophosphamide, or whatever it is, I will not have total body irradiation. So I guess that's a step for some of the other plans. But I just love that view. I just love looking out there. It really is pretty. But anyway, so that's what I'll be going through, and it starts here in about 3.5 hours at midnight. I'll post in the morning just to see what condition I'm in. I'm hopeful I'm going to be in a decent condition because there's only round one. I think it takes a couple days for you to start reacting. So in other words, if I did 2 rounds of chemotherapy, I'll start feeling on day 4. If I have 3, I'll start feeling on day 5. I think it's like, or maybe it's instant. I don't know. We'll find out together. But I feel really good. I got a really good attitude, and I think my body is about as good a shape as it's been since January when I first went on FMLA for my foot injury. So we'll see how it goes, and we'll keep you posted. And for those of you out there who have CML, have faith. Let's get through this together, and hopefully I'll set a good example, and you'll have courage. Thank you.